Times when, as an industry, when we have a discussion regarding dental implants, you'll hear people say, I'll use guided when I have a tough case. When I have an easy case, I'm just going to freehand it. But let me explain to you what we're really saying when we say that. So if we look to the anterior aesthetic zone, we oftentimes don't have very much room for play. We have very limited volume of bone, and we have vital structures on the left and right of our implant. We have teeth right around it, right? And it's in the aesthetic zone. It has to look good. So in cases like that, a lot of times people say, well, I'll use a guide for the sole purpose of ensuring that my implant goes in the right location within a couple hundred microns of its desired position, prosthodontically driven. That same person might say to someone, but when I'm in the posterior, I don't often use a guide. And so what they're indicting themselves by saying this is that in the posterior, if I'm off by 1 or 2 millimeters in a positional direction, I don't care. And that's a failure to understand the significance of that error. That posterior tooth deserves the same amount of attention and festivity, the same amount of attention and festooning that we would apply to the front tooth. It deserves the same solution. It deserves an implant placed within a few hundred microns of the desired prosthodontic outcome. When you place an implant and it's off by 1 or 2 millimeters, you immediately create a Snoopy. You create enormous amounts of biomechanical complications for that solution for life. There's no way around it.